Today's episode is brought to you by Flash Media Studios, and we are sitting down with Dr. Elise Min, who is a board-certified plastic surgeon of Elise Min Plastic Surgery in Beverly Hills.
We talk about everything that any woman would want to know about, whether that's lipo, tummy tucks, breast augmentation. We even get into the face. So much information. I feel like we asked really good questions that you and I were both a little scared to ask.
Yeah.
It gets spicy. You guys are going to enjoy this one.
So today is for the moms like us who have children, and then you look in the mirror and you're like, not what I saw before. And maybe you want to start feeling like yourself again. And so we want to talk to you about everything for moms, everything from like non-surgical things to full-blown facelifts and mommy makeovers. And I think for me, like what I really want to talk about is talk about this without shame. Like I feel like there can be a lot of shame around this. I want to be realistic about this situation and like what it looks like for all different women who might want to pursue plastic surgery or a different form of non-surgical procedures to start feeling like themselves again. So I guess my first question would be like, when moms come in for their first consultation, like what are they really asking for? Are they like coming in almost asking for therapy, or are they like, no, please take the belly fat off of my stomach?
Great question. I think it's a combination of the two. And each person who comes in has their own sort of journey as to what brought them there. So some people, just like you alluded to, a little more therapy would be warranted. Some people who are going through like, oh man, and everybody's body changes differently after having a child. So some people are like, oh, snap back and I'm back in my old jeans 6 weeks after delivery. And then there are other moms who just never get back to their pre-pregnancy state. And they come in sort of with a sense of, it's sad, but a sense of shame, a sense of just kind of loss in confidence. So I just meet them where they are. And then in terms of sort of what they need done, most people kind of have a sense of, this is where I really lost what I really had before. And then during the consultation, it's a time for us to sort of identify those areas and then have a discussion as to how we can help that from sort of the least invasive to the maximal invasive ways.
We often talk about like through motherhood, sometimes you lose your identity before you find it again.
Mm-hmm.
But then it's like you look in the mirror and you're naked and you're like, especially we've both had C-sections in the past, breastfed. You're like, oh, well, forget about my identity of who I feel as an internal person. Like externally, I don't look the same. Like that identity, I think is huge. But when you say mommy makeover, can you tell me like what procedures are umbrellaed under that?
Yeah, great question. So it's essentially all the body contouring is a simple way of looking at it. So it has a component of breasts. So breasts change significantly after whether you've breastfed or not. Just going through pregnancy itself
Totally
will change people.
Yeah, like they just double in size.
Yeah,
even
exactly.
if you're not breastfeeding.
Exactly.
Yeah.
So it's very like focal weight loss you experience with a breast, and that leads to shape changes. And even though you maintain the same volume after you've lost your pregnancy weight, you realize the shape is no longer in the same distribution that it used to be pre-pregnancy. So doing some kind of breast work. So it can be whether you need an implant or you don't need an implant, you just need a lift or you need some fat grafting. So combination of things to make the breast look more confident for the patient. That's one part of it. And the second part is the rest of the torso. So the abdomen, the lower back, the flanks, and shaping that area. So it's essentially kind of entire body contouring.
Mm-hmm.
Yeah.
For moms like us who have like more than one kid, I feel like, you know, maybe if you have one, you kind of experience the pregnancy and postpartum, and it's almost like you're the way my OB explained it. It's like you inflate a balloon once and it deflates. It's like, okay. Then as you keep like inflating and deflating, like it starts to lose its elasticity.
Stretches a little
like,
different.
There's a lot of things.
Well, and then age is also in
Definitely.
You know,
because
age,
subsequent pregnancy, you're a little older.
Yeah,
too.
you're older.
Right, of course, as the
don't
pregnancy
bounce back the same way. I hate the word bounce back, but
oh yes,
for lack of a better term,
you don't recover the same way. But for moms of 2 or 3 or 4 or 5 kids, what's like the most common procedure they come in asking for?
They want their breast to look lifted.
Okay, it is breast.
Full up top. That and same thing also of I have loose skin in the abdomen.
Yes.
That I want to address.
Interesting. I would
same.
for me.
Oh, really?
Like first and foremost.
Well, okay. So like full disclaimer, like when I was 18, literally 18, a week after my birthday, I went and got implants because I was one of 6 children for my, one of 6 girls for my dad. All of them had boobs. Some of them had reductions. And then like the last one, me, was left with nothing. Like I was like an A. I'm like, I just don't belong here. So I went and put an implant in. I wish I knew then what I know now. I probably wouldn't have. However, my implants are still okay, even though it's been 18 years. But my loose skin in my stomach, I'm like, I have like muscles, and then I'm like, what is this Shar-Pei stomach?
Yeah.
It's the word. Like
I know.
but I also look at it, I'm like, this body has birthed 2 amazing children, and like I'm very grateful for that. But it's so hard to not look in the mirror and be like, oh my God, this loose skin.
I know. Well, let's get into like procedure by procedure with you. So let's talk tummy and core to start.
Yes.
Okay, so how do you decide between, for example, like a Kendra or a me, same issue, like just loose skin, lipo, tummy tuck, or let's not do anything at all and let's see how your body goes for the next couple years and then come back to me?
Great question. So it really depends on each person's kind of age, genetics, their future plans for pregnancy. Like,
Oh yeah, that's
done
huge.
or are you not? So in terms of the more maximally invasive ones, I would make sure patients do not plan on having additional pregnancy. So
Yeah, it'd be all for nothing, right?
exactly. So our bodies are incredibly it's able to essentially kind of adjust to new changes. So you could get pregnant again after getting a tummy tuck. It just becomes a more high risk OB situation. So you would be followed by a high risk OB during your pregnancy.
Wow, I didn't even think about that.
I didn't even know that that was possible. Yeah.
So it's amazing our body can still adjust. to
Yeah.
it. So when we have lots of pressure pushing from the inside, no matter what we've done, permanent suture or not, our body will expand because our body is made to accommodate new changes. So from that standpoint, with a little extra information for tummy tucks, when patients have pre-existing conditions that cause pressure from the inside where it's pushing from
Like
the
a baby.
inside. Exactly. Baby. So pregnancy or people who have severe constipation and they're kind of straining a lot. Or some women who have a lot of bloating. I have patients who come in and say, I wake up a certain way, and then by the end of the day, I'm so much more bloated. That's also a lot of added pressure from the inside. And patients who have, for whatever reason, chronic cough, and that also leads to kind of pressure from the abdomen. Those are people who also need to understand, are you a candidate for a tummy tuck? Yes, but also understand you will also have something that's always going to be fighting against the repair. So those patients, I always advise, you may have a little bit of a rounded look over time because of constant pressure from the inside.
Oh, that's so
Interesting.
interesting.
So
When you think of tummy tuck, I think of like maybe the olden days where it was like hip bone to hip bone. They cut you and they pull. Like, is it a smaller C-section? Like, is it almost like a C-section scar now, or what is the scar like?
the scar is still honestly from hip to hip.
It is.
The C-section scar is called mini C-section, mini tummy tuck. And that I would say in kind of, it's more of a marketing term in that people who are actually candidates for mini tummy tuck are people where friends would say, you don't need anything. It's for those patients.
Got it.
So it's kind of a zebra out there
Yeah.
for people who actually would benefit from that. These are people who have really sprung back after pregnancy well, and they just have the little tiny excess skin that they want to get rid of below the belly button. Doesn't need any muscle work. Belly button still looks like pre-pregnancy. It's for those people.
Oh, the belly button. We've met somebody there. She's like, look, I got a new belly button because with the tummy tuck, you get a new belly button.
Uh-huh.
So, okay, let's go to my own personal issues. Let's make it about me, my consultation. If you have loose skin, would you look at something like that? Would you say maybe there's something like, because there's lasers now, there's all these skin tightening. Would you recommend something like that before going in under the knife and going to something more serious?
So if this is where it's good to talk to a plastic surgeon before having done anything non-invasive, because non-invasive it is not as benign as it sounds to actual tissue. So after undergoing non-invasive procedures like radiofrequency tightening, and there are different names and different brands out
Machines.
there.
Yeah, there's so
Exactly.
many now.
Totally. So when that is done, then you're now creating extra scar tissue in a layer that makes, once you are a candidate for a tummy tuck, it just makes things a little bit more complex, a little bit more
wow. I didn't even think about
unreliable.
that.
So it's easy to just kind of add things on, being like, oh,
No big deal.
let's
It's surface. Let's
yeah,
just
let's
go over
just do this
this.
while we're
I'll
doing
take
it.
a
So
series of 8.
who doesn't want that as a woman?
Yeah,
I'm like,
done.
yes, sign me up for everything.
Yeah.
But it is important to also consider, do you actually need it? And this is where talking to sort of multiple plastic surgeons would be helpful. So you're not just kind of getting, one voice that's trying to sell.
Totally.
that
And I
at
feel
the
like
same
that's a
time.
very interesting perspective because I feel like there's so many, like we said, there's so many different brands of machines and like they're
Mhm.
labeling these different, like more, there's even, Megan, like
Yeah.
they're always going to find something of selling you on something, but you think you're doing the right steps by going to these minimally invasive treatments, but it actually could be doing more harm if you were a candidate later
Right.
because of
Exactly.
scar tissue buildup.
This is where you want to go to a plastic surgeon who we offer all of those, and then we'll assess the tissue and how much laxity there is. And then we'll be able to say, hey, you're a good candidate for this non-invasive. You're a good candidate for this invasive, or a combination. We'll be able to give a tailored sort of tailored plan for the patient. Whereas if you go to a place that only offers non-invasive, their only treatment is non-invasive. They're
They're
only
not
going to
be like,
sell
let's
you.
actually, yeah.
It's I mean, you may come across somebody who's honest enough to say, oh, we can't really help you there, but when you go to a place that sells hammers, they're going to sell you a hammer sort of
Right.
thought process.
Totally.
So that's where kind of early on, before you get anything done, before you introduce unnecessary scar tissue, you want to think about going to a place who gives you the right advice as to what you need.
That's incredible advice, especially because I think a lot of women feel that if they're booking with a plastic surgeon, that means they're immediately going under the knife. And that's not
No,
always the
that's
case.
definitely not it. And as a surgeon, one thing is when, of course, we learn when to operate, but as we have become more seasoned, the thought is when we know not to operate. So if you go to the right person, you'll get the best advice.
Perfect plan for you. One more last question on tummy tucks. Okay. So when you see a tummy tuck, it seems very like tight.
Mhm.
Do you like ever gain weight after like can your tummy tuck ever, or is it always going to be flat? Is that a dumb question?
No, that's such a great question. And
Okay.
I wish every patient thinks about that because, like I said, body really adjusts to the changes we
So it'll adjust to
experience.
Taco Bell if you continue to eat
Yes,
Taco Bell daily.
exactly. So it would be kind of a waste of money
Yeah.
if somebody has a lot of weight gain after undergoing a tummy tuck.
Okay.
Waste of money and waste of it's a big
And
surgery.
Absolutely. The entire healing journey is not the easiest of
Yeah.
all the plastic surgeries out there. So from that standpoint too, it's a lot of effort, a lot of money, a lot of
Downtime.
time.
Okay, one more question actually on the tummy tuck. Why do we do a new belly button? Like, what is it? I'm like, is it because you're stretched down, the belly button
It's
stretched?
because we are removing an elliptical shaped skin on the bottom. So we're now pushing this down. The belly button is only kind of poking out in the middle of the abdomen. So now we have new skin that's on top of it, and belly button is buried underneath. So we need to make a little window for it to poke its head out.
Oh, so it's still your same belly button.
Yes.
It just has a new.
That's
You just have to cut the skin around it.
99% of the case.
Because some of the women that I see that have had it, it's like
Yes.
you see the new belly button and it
Mhm.
looks like you could put a perfect penny right in it. It's like a crater hole, like boom.
Yes.
Is that because it's been cut like
So
that?
yes, our belly button. Every plastic surgeon has their own artistic way of making their belly button look the most natural.
Yeah.
So essentially 99% of the time you have your native belly button stock that we cut around. So it's hiding like this. And then we pull the skin down and we create a little window. So our little belly button pokes its head out. So that's majority of tummy tucks we do. There are some patients where for different reasons, the belly button has big issues where it doesn't look good. Even if we made it come out, it's not going to look very nice, or tissue has certain scars and we don't want to use it. Then we will make a completely brand new belly button using this
Sounds
skin.
like science fiction.
So
It's wild.
that's less likely to be the case,
Yeah.
but that can be the case as well.
Wow.
That was a good question.
Well, because who I'm thinking of that we saw her new belly button and I'm like, oh my gosh, like She's like, yeah, I got a new belly button. I'm like, that is like the most wild thing.
Wild.
It really is not, though, I guess, when you think of all the stuff that is out there. Okay, so what about the moms that need maybe a little lipo before they even think about a tummy tuck? Like there's some extra fat. And at what point are you like, no, you're still in your healing journey and you still are postpartum? Like, is there 6 months, 9 months, a year and a half? Like, what does that window look like for you to be like, yes, this is just extra baby weight and we need to do some lipo?
Yeah, I think that depends on individuals. As you've seen probably with your own bodies and your friends, some people just lose weight and spring back really fast. So people who've already sprung back and they've sort of maintained their new weight for about 3 months, they are candidates. So one of my really good friends, she sprung back in 6 weeks. So on somebody like
That's her,
that,
that's this one. I was like, I'm sorry, can you not?
yeah. And in this sort of situation, she doesn't even need anything.
Yeah.
But let's say she did, then I would probably consider doing surgery 3 months from that 6-week point where she kind of reached her weight that she's usually fluctuating in. So 3 months from that. So if somebody is still losing weight, I would generally advise, hey, where are you? You're still losing weight. Some people have a goal weight that's a little bit, everybody has a goal weight, and that may be in the world of not realistic to realistic. I like to ask, hey, are you at your happy weight? So yes, goal weight might be 10 pounds less, but if you're at your happy weight where your body likes to be in, that's a good place to get surgery.
Yeah, two very different places, happy weight versus goal weight, like where
Mhm.
your body is happy.
Okay, I'm
versus-
dying to know, is your business changing at all because of GLP-1s?
Definitely. There are
We're pulling skin, not sucking fat, right?
still both happening,
Both
but
happening.
a lot more skin laxity.
Yeah.
And I have some lovely petite skinny patients coming in and they're on these GLP-1s and I'm like, "Oh, why are you on it?" "Oh, maintenance dose." So I see a lot of that as well.
Maintenance dose.
Yes. But part of it is I think some people have really benefited from it. So the stubborn weight
Yeah.
that they were not able to
Right.
address before,
Yeah.
but they also didn't want to undergo liposuction really has worked really well for those patients. But the only downside is maybe the fat has gone down from areas they wanted, but it also went down from like butt where you don't want that. to
Right.
happen.
Okay, now
So
okay,
You can't
so
pick
this
and
is like,
choose
let's
where
do
the
some-
GLP-1s
Yeah.
work.
Like, excuse me, I'm just working this section of some planks, leave the ass.
You know,
Yeah.
that would be great if
Yeah.
GLP-1 came out
Right?
with specific receptor
areas.
targeting.
Yes.
Oh
function.
gosh, if only we could market that. Like, leave it in the butt.
I know, that would be nice.
Ah.
Okay, just to get really basic for a second, can you just explain the procedure of liposuction?
Absolutely. So liposuction is essentially vacuuming fat out.
Okay.
So I make a little tiny.
You look too pretty to be vacuuming anyone's fat.
Oh,
Like, could you imagine her in an
I know,
OR? Like,
I can't even imagine her in an OR in the first
I
place.
know.
but-
sweet.
You're like, look like you should be casted
Yeah.
for a plastic surgeon.
Oh my gosh. So it's a very small incision between my fingers, about 5 millimeters. And I would put them in areas that are easily hideable. So one in the belly button, you'll never even see that as your
Back to the belly
own.
button.
And some by sort of in your bikini line, so it'll hide there. So all areas that are very discreet. So then through that incision, a little vacuum stick will go in. That's the lipo cannula. And that goes in and it's connected to sort of a power assisted machine. Then it creates suction. So
You just
kind of-
poke and
So you
prod
are
around.
literally just
Exactly.
vacuuming
And to
fat
avoid
out.
too much bleeding, we put in fluid that helps with minimal bleeding. So it helps decrease bleeding and it helps with pain too. So it's a tumescence fluid that we put into the body.
while you're
Let it
sucking the
sit for
fat
10
out.
minutes and then we start. So there's less.
Well, do you
blood
have to be
loss.
careful of like not to damage anything in there too? Or are you like truly in the fat layer?
We're truly in the fat layer, and this is where you're going to a board certified plastic surgeon to
Very
know
experienced.
that it's going to be in a safe space. If you just look at the procedure itself, it looks like anybody can
Yeah,
do
I could
that.
do that.
Yeah.
But there
Very
are
complicated.
areas where there are complications you hear about where the cannula went through the abdominal wall and goes into an organ. And this can happen even in situations where patients have previous surgeries before, so their scar planes are a little bit different. So this is why it's important to go to people who know what the risks are and how sometimes the most benign procedure can have really awful complications.
Yeah.
So knowing people who know what to do and what not to do, that's board certified plastic surgeons.
Yeah.
And that's one way to keep it safe.
You know, I feel like you just hit the head on something that is a much bigger conversation. But I feel like for moms, it can be something when they look at this that they feel very selfish of how could I put myself in this position of potentially some risks, life-threatening risks. I mean, forget even complications with a cannula, of like going into an organ, but how about the fact of just like you're under anesthesia? Like there's always a risk with that. Like, how do you talk to a mom about that kind of emotional pull of like, I really want to do this for myself because I feel like I'd have more confidence and I could show up better in my life. And I want to do this for me versus I'm going under this and I feel selfish because I'm a mom and I should be only focused on my kids. And what am I doing? Putting myself in this situation.
I think every mom comes in expressing that sentiment. So it's truly everybody, and it totally makes sense. So I acknowledge it because as a mom, I would feel the same way too. And I would want my doctor to understand that. And then once we have that connection, then just kind of also, that's the reassurance part where it comes in. You are truly in the healthiest state of what would be of your life, right? Because we can't live in the past.
Totally.
Today is our most youthful version. So that makes anesthesia experience also the safest today compared to when you are 10 years older or 20 years older. And the other perspective is we go to hospitals, and when we go to hospitals, when we get surgery, we're not thinking about that as much. Oh, I got appendicitis. I'm getting this urgent surgery, regardless of my smoking status or regardless of my ideal weight. I'm getting the surgery done.
You have no time to prepare.
Exactly. And those surgeries are being done and people still do well. So this is an elective surgery. Before I operate, I make sure everybody has their pre-op clearance. So the primary care physician signs off. We check all the labs, make sure you as a patient are in the safest sort of possible state to undergo general anesthesia. Then things are as safe as it can go.
You mitigate as much risk as you can.
Yeah.
Exactly.
Yeah.
So when we're talking about lipo, I mean, if I'm thinking about myself in lipo, I can think about 4 places that I want lipo. What are women?
What?
You know, like my
my
hips, like back here, my stomach.
Easily slid that in. I have 4 places I'd like lipo. What?
Yeah. Well, if I'm just thinking, like, I don't think, or
Taylor.
maybe I'm wrong, but like, do women come in just asking for like one place of lipo, or are they like, oh, well, you're in there. Why don't you take it from
Wait, that and also can you take it there and put it somewhere else?
Yeah,
well, I know that would be
the
next
my
thing. We have to get into that in the face.
So
later.
that's I'll start with, do they come in with just one area? Some do, but most people come in thinking like, oh, I'm bothered by this and this and this and help me.
Yes.
Is usually, and that's a good place to start. And then I'll kind of explain, hey, if we just do this, this is what we can expect. But if we do the 3-dimensional sort of sculpting, then it looks a lot better. Because you also don't want to be 2-dimensionally, like from the side. Look at my flat stomach. I had one patient who didn't want 3-dimensional lipo for sort of the fears of what you said of like, I don't want my anesthesia time to be long and I just want this and I'm okay.
Get in and out as quickly as you can. Yeah.
So this was kind of early on in my practice where I'm like, okay, what the patient wants, I'll deliver. And afterwards, she was very happy. And in my mind, I'm like, oh man, I wish I could have 3-dimensionally.
Well, the fact that you're still thinking about it now.
Yes, exactly. So that's one of those things where now I will advise patients if I do not recommend it. I'm a little bit more kind of definitive about what I counsel my patients. And then if you want this look, it's really sort of the 3-dimensional shaping and sculpting of a woman's body that'll make it beautiful. Because we're not taking 2-dimensional photos. We're not cartoon characters. We're live in
walking
3D.
Around flat. Yeah.
Exactly.
Yeah, unfortunately, sometimes, right?
I know. So you will just like look at the body, and if it's like, I think you need the waist, I think you need the back, I think you need, just do it all.
Yes. And within reason. You know, some patients come in saying like, I'm not interested in anything big, but I want to look better. Then with this, you can look better. And there are certain areas like lower back, flanks. Those are very important key areas to make it look good beyond just abdomen. People come in thinking, I need some work in abdomen.
Oh, no.
But
It's
really
all around. Yeah.
This is like
love
number
handle.
1 for me.
Forget about love handles, the flanks, because I feel like for women, like you see your stomach here and then you see these sides, but not all the time are you looking from the back. Or I feel like a lot of women have these things like under like the
That's
bra
what I
fat.
said.
Exactly.
What do you call that? Bra fat or whatever that is. Like, but like you get some wings, fat wings back there.
Yes.
Yes.
And that's where lipo is very helpful. Those are areas where we don't cut tissue out. Lipo is very, very helpful. I mean, we do have technically for massive weight loss patients, we would cut tissue out. For most women of your sizes, it would just be liposuction.
Okay, I swore I heard this many years ago, and I know that it's probably wrong, but that lipo can cause more cellulite.
Yes.
Was that a myth a long time ago?
That is not a myth. I would say I would kind of agree with that in the
Okay.
sense that we're deflating volume from skin. And this would be a situation where somebody has pre-existing cellulite.
Okay.
And cellulite is essentially a connection from your skin to sort of underlying sort of the coverage of the muscle and bone. There are sort of fibrous scar connections, and that's why it's giving that puckered look. So if you remove fat, then it just accentuates the area where the puckering exists. So sometimes cellulite can almost look even better when you kind of fill in with a little volume.
Yeah.
Right.
So those are, I wouldn't say that's a true myth. That does have that visual impact.
Some
Oh,
truth to that.
interesting.
Yes.
Well, okay, I have a question for you. When I was in college, one of my girlfriends had gone through lipo, and she, in her mind, she was like, "Oh, I did it here." I think she did it like her pooch and like love handles, and then she felt like the fat went to her arms. Have you heard that? Is that like a thing?
I get that asked a lot.
Like if you take it from here, it's going to go somewhere else. Like, is that like an old wives' tale?
So I think it's more kind of optical illusion sort of phenomenon. When we remove fat cells,
If you find something else to pick on yourself, you're like, oh.
As in, like, once we remove fat cells from a certain part, the number of fat cells that exist in that area are a lot fewer. So what that means is when we gain weight, we're still gaining weight in areas of liposuction and areas we hadn't lipoed, but the number of fat cells now have changed, right? The areas where the liposuction took place, there are fewer cells. When we gain weight, our individual fat cells actually get fat. So even the liposuction areas, when you undergo significant weight gain, it will gain weight. It just won't gain weight like it used to.
Oh, so that is true then in some ways.
Will gain weight like it used to.
Yeah.
So to our eyes, it'll look like, oh my gosh, I'm gaining so much more weight in these other areas where lipo didn't take place. But where lipo did take place, you may be gaining weight, but to your eyes, it's very different from what it used to be. And it almost looks like the areas of liposuction that didn't take place are gaining weight.
Got
much more.
That's so interesting.
Yeah.
Wow, gosh, I guess all these questions we have are right. What does recovery look like for lipo?
Lipo, it's minimal incisions. So it's going into a compression garment to help with sort of the fluid. The lymphatic massage would be very helpful, and compression garments will also help with the overall healing. So no heavy lifting, somewhere between week 2 and week 4. It's a little sore. Liposuction is not a pain-free surgery.
Yeah, I feel like people think it's like, oh, in, out, moving on with your life, but
it's a major surgery.
Yes, and it's a little sore in the first couple of days compared to maybe the breast surgery might be a little bit more manageable. Where like, oh, not feeling a whole lot of pain, maybe a little just I feel like I got surgery is what my patients would say. Yeah. Liposuction people feel
they got hit by a train.
Got surgery. That's more tummy tuck, perhaps.
Yeah.
Liposuction is more kind of like, what's one less than a train?
One less than a train. Get hit by a bike.
Is there a lot of bruising?
Depends on the patient.
Okay.
So there are some patients who are prone to more bruising. And also I counsel my patients there are things we take that's healthy in life that we would minimize 2 weeks leading up to surgery. These are called blood thinners.
Okay.
Food, exactly. And ginger, and also in supplements, vitamin E and omega-3 fish oil. In the pain medicine category, all the ibuprofen and the NSAID category, the aspirins.
Alcohol.
I would have them stop for 2 weeks beforehand, and then you resume 2 days after.
Okay, so let's get into breasts. I feel like this is like the exciting part, because for women, I feel like it's just so much of your identity, like boobs, which is like, why? I don't know. How do you guide a woman that is coming to you that maybe has breastfed and is thinking, I need some volume up here and I want to be perkier, but I don't know if I want an implant or a lift? How do you guide that conversation?
Great question. This is where we are looking at a full-size mirror together. And then I actually have my patients kind of touch their breast and then sort of move it around to show me what they want. So a lot of the times people feel this pressure of, oh, I don't know what cup size I want to be. And honestly, I don't really care what cup size that is. It's a very subjective matter of measurement. It's not very helpful. So some people, recently I had a patient who came in with a small B cup and she wanted to be a large B cup. She didn't want to be anything bigger. But once she kind of started showing me what sort of breast large B cup she wanted, it was the sort of style where implant is necessary. Now, when you're thinking small B to a large B, does that really require an implant? Can we just do some fat grafting? So there are a lot of other tools that have come about on the market that people know about. But in terms of what actual shape and sort of design of the breast each person wants, the surgery they need is different. And this is something during consultation, I have the privilege of being able to kind of tell them, hey, based on what you just said, if we just did a breast lift alone, or if we just did lift with fat grafting, it's not going to quite get you what you just did with your hands.
That upper
to your breast.
projection.
Exactly.
Yeah.
Are most moms post breastfeeding and pregnancy, are they coming in wanting bigger or just back to where they used to be?
Generally in the current sort of scheme, back to where they used to be is what
Okay.
people want.
So I'm just going to go ahead and explain my situation. If you are a guy, please tune out. So I feel like I used to be a decent size. Like, I mean, I still am now, but this is like so embarrassing that I'm saying that, but like all my boobs always hang like out. Like sometimes I can look completely flat in my sternum, but I'm like a full size C. So I've always said like, I want something to like make them go just like normal, like not under my armpits. Okay. After breastfeeding, I feel like even if I did that, I just don't have the same volume that I used to. Is it possible for me to just do a lift without an implant? I know you would have to see them, but like, what does that look like to just do a lift?
And that's where standing in front of the mirror is helpful because everybody's skin is different.
Alvin, get the
Yeah.
mirror.
How
Take it off.
Could
Turn
you
the camera down.
imagine?
Oh, I
Oh
would.
my God.
Excuse me, Dr. Min. I will lay right here.
And for some women, if they have started out with breasts that are sort of C cup and larger before having children, lift alone can look beautiful.
Okay.
And my patients will ask, did you put an implant in? I'm like, that was not on your consent and that is not happening. But
Okay.
immediate after, it can look like an implanted breast by doing lift alone. If you have tissue that I can work with, where I can do some origami and
Wow.
making it like a cute cinnamon.
Some origami cinnamon.
Oh my
Wow.
gosh.
However, if patients who've had A or B cups in the past, there's not a whole lot of meaningful volume I can work with
Okay.
to give the look people want with the fullness up top. So
Even if you're doing a fat transfer.
fat transfer can it can help in certain situations to somebody's satisfaction, and other times it's not enough. So it's 50-50.
Okay, so something like hers where she feels like they're over here, is that something that can you do I'm like trying to show.
I know. Well,
Like,
because
if they're here, can you lift them back here?
or do they need like an implant on the side? Or I don't even
On
know
the
what I'm
side.
like Play-Dohing. I'm thinking of like my boobs, like how you would make it, or do they need an implant?
Again, very hard to say
I
without
know.
looking at your breasts, because
Yeah.
some people have also breasts that just naturally sit wider
Yes.
with a wider cleavage distance.
Yes.
So those are patients where I would talk about doing potentially an implant placement above the muscle, so I can cheat my way a little bit to be a little bit narrower cleavage than putting it under the muscle where I'm limited by where the muscle attaches to the bone. So
Okay.
these are things I would be kind of thinking about. Just based on what I'm hearing, lift alone is only going to kind of lift it in the position.
In the same
that it's in.
position.
So
Yeah,
it's
Yeah, I
not
don't need
gonna
them
do
lifted
this.
in my armpits. I need
So,
them in.
If we did fat grafting to that lift, I could probably create a little bit more narrow appearance, but depending on where we're starting out with, it may not be enough.
Okay.
And for others, it may be. That's where it's kind of 50-50.
Yeah. Well, and I know
individual
that
case.
it's so specific to each patient. Is putting the implant above the muscle versus under the muscle like a big recovery difference? Is it like one is way less invasive, or is it just kind of all the same?
In terms of the incision itself, it's the same. The difference is there are different pros and cons. There's not one layer that makes it this is 100% better than the other. It's pros and cons. So if we put it under the muscle, the pro there is you have the lowest risk of what's called capsular contracture, which is thickening of the scar that naturally forms around implants for everybody. So that risk is the lowest under the muscle.
Okay.
The downside of under the muscle is that some patients develop animation. It's low risk, but some people, when they squeeze their chest, they see their sort of skin
yes.
and implant
Oh,
move
yeah.
a little
Yes.
bit unnaturally,
Uh-huh.
like at the gym or when they're coming out of a pool. That's when it exaggerates. So that risk is there when you put it under the muscle.
Okay.
Now, when you put it above the muscle, you have no risk of that animation. And sometimes for patients who have wide cleavage, we get to put the implants, I get to cheat a little bit to create a little narrower cleavage, which patients generally desire. However, it's not the best for people who have very thin skin up top, so people with very small breasts, because implants do naturally ripple a little bit when it stands. So for people who have it placed above the muscle with very thin skin can risk a little bit of rippling that shows through the skin. So
I've
it
seen
really
that.
depends on the individual and what would be
Question for
best.
you. Again, when I was 18, made the decision to do my breast augmentation too young. I'm like, God, I couldn't even have a legal drink. I shouldn't be able to decide to go get a breast augmentation. But I did under the muscle saline. I was too young for silicone. And I couldn't breastfeed either of my kids. I was also IVF, so I don't know if that had something to do with it as well. But could that have any impact, like a breast implant with breastfeeding?
Under the muscle,
I was under the muscle.
practically no.
Practically no.
Yeah,
Okay.
because putting
I've
it
always had
under
so
the
much guilt
muscle.
about that. Of like, oh my God.
No, let me
Rid
shed
me of
that
my
guilt
guilt.
here today.
Yeah.
Leave that behind. Never let that haunt you again.
Yeah.
Because putting the implant under the muscle, that surgeon did not touch a single milk duct of your breast tissue.
Okay, that makes me feel better.
Because those all are untouched on top of the muscle.
Yeah.
So, but I always tell my patients there's about 5% of women who are born where they're not able to breastfeed, but you won't know that status of yourself until you're trying to breastfeed.
Yeah, like I could always get a little bit of milk, like 1 to 2 ounces, but I never had a letdown and I could never get over 2 ounces in any single feeding.
That's probably your
Born with
genetics.
it.
Whether even if you didn't have implants at that age or at any point, it wouldn't have changed.
Really?
Yeah.
Wow. Okay. Interesting. Also, not to make this all about myself. So my boobs are I'm 36, so my boobs are 18 years old. And I've always heard like at 15 years, you need to be getting them redone. But I'm like, I'm not having any issues. Do I need to get them redone?
Great question. And there's sort of the FDA answer of yes, you should. And that's every 10 years.
Oh,
and
shit. I'm 8 years old. Oh my
It's
God.
not, but it's not
You're molding over there, honey.
it's not a ticking bomb because, you don't have to put that on the calendar reminder. It's kind of when you have time, go get them exchanged before capsular contracture and rupture risk goes up further. So there's a reason why 10-year came about, because the manufacturers of these breast implants have seen beyond 10-year, the graph of sort of the rupture and the capsular contracture risk is a little bit higher. So they usually say warranty is for these first 10 years, and afterwards we're not,
You're on your own.
replacing your implant for free.
Yeah.
So, but within the first 10 years, generally most brands would. So I would say 15 years, I would. Now, in the context of there is this very, very, very rare type of breast cancer called squamous cell carcinoma of breast implants. There's only like 19 cases in the US that we know of. So there are all these sort of very rare kind of chronic inflammation associated conditions. We're not exactly sure, is that even really something that's going to change if we get them exchanged at 10 years, that you wouldn't have that risk? We don't know that data right now, but it would be reasonable to get them changed every 10 to 15 years and get a fresh pair in.
Well, looks like you got to pay a visit to Beverly Hills.
Well, and my whole thing was, oh my God, if I have a third kid, I don't want to do that. I don't want to get my breasts redone and then have a third kid. Like I want to wait till I'm done. But I'm like, that time is just, I'm going to get to 19 years and then 20 years. Like I've got to figure this out. Yeah.
I know. Well, okay. So I want to wrap up breast implants with one question that is maybe a little bit controversial. And I know the internet can be a scary place. So I just want to clear this up. I feel like people can be very scared of implants for many different reasons, risk factors, illnesses, all those things. What is the biggest risk factor, or what is safety maintenance for implants, or how do women feel confident that they're making the right decision to look like themselves, even though they're putting an implant in?
Absolutely. That should be a conversation that should be had with a plastic surgeon every time. The full on sort of, what does it mean to have implants?
Yeah.
And first of it is, once you have implants in for the first time, you are signing up for future surgeries. And that's something patients need to know, because everybody gets excited about, oh, I'm trying on these sizers and the idea of having bigger breasts is so exciting. However, they also need to understand 10, 15 years down the road, you're getting an exchange. And if the younger you are, that exchange is going to be more than once and potentially more than twice. So those are things just to be aware of and not being surprised later on. I have patients who come in who had them placed a long time ago and they're like, oh, nobody ever told me that. That's a very important part of understanding.
It's not a one and done.
Exactly. It's kind of understanding, all right, when I get this done, this is something that I have to sort of upkeep for life. So that's an important part to know. From a safety profile, implants that we're using in current generation are all something that we've been seeing for a long term. There's no implant where it's like, we've been using implants for 1 year and this is how it feels. Things have been around since the silicone moratorium had ended, which was early 2000s. So we have data from early 2000s of the current safety of the implants we're using. So that's pretty good in
Mhm.
medical literature in terms of timeline and seeing what is safe. Now, as it is a case, even when you're getting orthopedic surgery for a broken bone, you're getting hardware in.
Right.
And when you do, there are just pros and cons of having something that's not your body, in your
Foreign
body.
object. Yeah. And your
Exactly.
body goes to attack it naturally, right?
Yes, and that's why it forms that capsule,
Scar
the scar I
tissue.
told you about, and that happens around our orthopedic
Anywhere, yeah.
hardware, anything where hard foreign body is. So that happens around our breast. The only thing is we see it more when it has thickening of it, whereas it can happen on a hardware we don't see it because it's right
Mhm.
next to a bone. But breast is a lot more softer tissue that we see those little differences and distortions. So that I would say is the most common side effect of having a breast implant is capsular contracture, where studies will even say up to 25%. It really kind of varies, but the longer you have the implants in, the risk of the thickening of the capsule is higher.
Mm.
For some patients, they may have it and they say, hey, it has not impacted how I look or how I feel. Those are very mild cases of capsular contracture. And for others, they may feel that, oh, wow, I'm starting to see some distortion of my breast. This feels weird. This is getting tight. That's a little bit more severe case of capsular contracture. Now, what do we do about it? If it's severe enough, you get them exchanged, you take the scar out, and then
Restart.
restart with new implants. Or some patients these days will just say, hey,
I
I
want
want
to
to get
explain. I'm
implants
done.
out
Yeah.
and I want fat grafting instead to make it look natural and embrace sort of that natural kind of breast shape.
Okay, fat grafting, like say I was like, okay, because I had nothing and now I've
Mhm.
got, I think I have 400 cc's. Say I was like, I want these implants out and I want fat grafting, but like say you're like, oh, well, we
You'll
can't
have to
take
take some of my fat.
that, like you can't use somebody else's fat, right?
No,
It's
we
illegal.
have
I know.
I
I've
have
only,
such a
No.
long list
Dr.
of
Min's like, no, you psychopath. Who am I speaking to?
No.
husbands and partners who
Offering their fat. Of
Exactly.
course.
Yeah.
That's another, by the way, great business idea is being
Right?
able to kind of harvest those fats
Yes.
and then being able to give it to somebody and having
Is it because somebody's body would reject that fat? If it's not your-
1,000%. When you think of kidney transplants and different kind of transplants, they are on immunosuppressants for life. And there are a lot of side
Wow.
effects of being on those immunosuppressants. And the reason is because our recipient body will attack the donor organ if we don't take those medications. So, and this is even in the context of like the perfect kind of donor match where you can have that.
Even in that
So-
case, yeah. I know these are very
So,
superficial questions I'm
unfortunately,
asking. I apologize
It's
to our
only your
listeners.
fat, you don't have enough. You'll probably have to get some implants.
Oh, yeah.
But you're speaking for the public. These are
Yeah.
questions
Yeah.
I get all the time.
Yeah.
Oh my gosh.
Yeah.
Okay. Well,
Thank you, Taylor.
after the breasts, maybe for moms, maybe the most important is the face. And I think it's like a lot of moms we know are starting on the face
Mhm.
even before,
Oh,
like
yeah.
not. Okay, I think the issue we all come in is like we look tired.
Mhm.
Obviously, we've just been in the trenches with kids. And so we want to look, more awake and feel more alive. What are like the first kind of procedures you're seeing women coming in asking for when it comes to the face?
And face, I will say, is where non-invasive options are a lot more available.
Okay.
Like a
So that's in my mind still maximally invasive.
Oh,
We're
it
actually cutting
is.
skin out. So I'm thinking of like non-invasive injections. So
Oh, okay.
neurotoxins, which now we have so many different brands, but Botox is something everybody
Okay.
has heard of, or fillers, and there are different types of fillers. That's kind of where people start usually.
Mhm.
Probably with neurotoxin is how
Yeah.
people start. And then with neurotoxin, you also see a little bit of like skin improvement, just looks a little bit more glowy. And these are then people will get skincare treatment and getting
It's the
lasers
gateway
and-
drug, the Botox.
Yeah, it is.
You're like, well,
It
that was
really
easy
is.
and that looked great. So what else can we do here?
Well, a lot of people that we know are stepping into the eyelid versus the eyebrow surgery kind of
Mhm.
thing. I'm seeing that it's a quick turnaround.
We know people that are like early 30s.
Yes.
Even late 20s getting a bleph
Yeah.
and getting a brow lift.
Yeah.
So how do you decide, like, what does each procedure do?
So brow lift is essentially just like our brow and giving a little bit of sort of the it makes it for people,
Permanent Botox.
yes, that's a good way to kind of say it.
Just a little.
And then with the eyelid, you might even experience it when you get sort of a stronger neurotoxin injection, or I'll just call it Botox injection. Then you might notice your eyelid when you're doing makeup is like, oh, it just feels a little bit heavier.
Yeah.
And that just kind of mimics how we would age. Of like, once we age without even the neurotoxin, that's sort of the level of skin that we're going to experience. So some patients catch on fast. I have patients who are coming in at that age group of like early 30s. I look just like my mom, and I've seen my mom age, and this is what her eyelids did. And I just want to get to it quickly because I already know I'm going to need it. So might as well do it when it's at a
You can enjoy
mild
it.
case. And I don't
You can enjoy it in your 30s.
Right.
exactly. And so I do have patients coming in asking for that. And that is also normal. And I think we're entering a phase in plastic surgery where at once we're all about maximize non-invasives, and when that fails, let's go to maximal sort of skin cutting surgery. I feel like we've left that phase of plastic surgery, and it's about how do we intermingle the two together to get the best results with sort of minimal kind of crazy look in between
Yeah.
to get to that finesse elevated look.
It's like minimal,
earlier.
maximal.
Right.
Yeah.
Yeah,
and it's
like
a
where's
mix
the
of
in
two.
between? Let's not like go full blown facelift. Okay, another one that I've seen some people I know that are starting to get is the brow lift, or I'm sorry,
The
not
lip
lip lift. Yeah,
Yes.
and like you have a little kitty cat scar under your nose, and then it shortens your, what is this called? Your Viltrum?
This is a Filtrum.
Filtrum.
Yes.
Okay, so what is with this? Like, it's because people are getting lip filler, and they're like, no, let's just like instead of the filler, it's like cutting the line, and you're like, I'm just going to do it surgically.
Yes. I mean, that's essentially what it is. And some people do have sort of the longer Filtrum length, and then doing a little bit of that really just kind of lifts their appearance. So that one, I would say there is.
These are all anesthesia. Is it general or is it like Twilight?
Lip lift alone can be done under either,
Okay.
because it's just kind of skin cutting. So you could even do it under local potentially.
So
Just
you're like awake and you know what they're doing, but you don't feel it.
Exactly.
And
Kind of like
same
a
with
dental procedure where they numbed you up. So you know there's some pressure and you know things are going on. You're awake
Yeah.
for it, but you tolerate it without too much distress.
Same for a brow lift and a bluff. They could do it that.
Or bleph, definitely. Upper bleph, easy peasy. That's another very common local procedure. Even
That has
done
got
in
to be
clinic.
so crazy though, knowing like you're awake laying there, knowing you're
Cutting your
skin is
eyelids.
being cut open.
Yeah, that is crazy.
Right.
She's like, no, not
There's
She's like,
also
"There's
people who,
no
I don't do this, but there are surgeons who offer awake facelifts as well.
No, that
So-
is crazy. Okay, let's get into it. Because
Yeah.
this would scare me the most
Mhm.
personally if I were going in for a surgery. And it would scare me because it's my face.
Yes.
Everything else I can hide.
Yeah.
You know, if anything else goes wrong, I can put a shirt over, pants over, whatever. But the face just seems like it could go wrong, or I could defrost the wrong way, after, like that it wouldn't go according to plan. And I do feel, okay, Kat Sadler,
hmm
she's like 40 and she got a facelift, and she's like this promoter of like, people told me I should wait until I'm in my 60s to do the facelift. And I didn't. Like, she was just felt like she was droopier, did it. And she looks amazing, but she got a lot of grief for doing it so early. So what makes someone, and I know it's specific, but what makes someone a good candidate for a facelift? And are you seeing people come in younger?
Most definitely. That is definitely a newer trend in plastic surgery in the recent years, is people coming in for these sort of the shift of going from non-invasive, maximize non-invasive, and then get to invasive when it all fails. That paradigm is gone, and it's all about how do we incorporate and weave in maximal and non-invasive together to get sort of the best natural look without having to undergo those sort of awkward phases where somebody doesn't look as good.
Right.
So from that perspective, I know from kind of traditional thought process, my gosh, getting facelift in their 30s and 40s seem young. And for some
That's
patients,
so crazy.
it may be. But there are some patients who genetically have skin that's a little bit more, how should I say?
Saggy.
Yeah, saggy, and just kind of, you see some patients who are some people naturally at 30 have different skin than somebody else who's 30.
Yeah.
Like
Yeah.
in our 30s, we all age at a different rate,
Mhm.
which is kind of sad to think about it because in our 20s is the last time when we're all kind of looking like, oh, prime
The
In your
time.
same.
20s,
Yeah.
yeah.
And then
Yep.
starting in our early 30s, for some, they're still in their 20s look. And for others, they're really kind of starting to, the skin
They're on the
quality,
descent.
the tissue is
Yeah.
aging. And of those patients, doing those early facelifts and early face maximal work can be very beneficial without kind of delaying by doing non-invasives that make them look very puffy or unnatural.
Okay, so speaking of like non-invasives, like filler or even Sculptra, like
Mhm.
I've heard that if you do too much of these kind of procedures, and like it's easy to go to, you can go to a doctor's appointment for an hour and come back and you've got a few filler and syringes in your face. But I've heard that if years later you go to get a facelift, it could actually have been done more damage because of all the scar tissue that's built up now.
Correct.
Is
It's
that true?
similar to, yes, that's
Similar to
definitely
like how we were talking about the stomach, like you're in there
just like I
upsetting
told you
things.
about the radio frequency
Yeah.
energy, kind of is causing scar tissue or even liposuction alone. When you come for a tummy tuck and you're doing lipo, we've had lipo before and you have scar tissue
Yeah.
there, it makes the surgical procedures down the road a little less predictable in terms of outcome. And that can happen in the face too. So that's why we dissolve our faces if we
Before.
beforehand, exactly. But that doesn't dissolve the scar. Scar is permanent. If
Yeah.
it's there, it's there.
So what do you think of Sculptra? Because I've heard that that causes a lot of scar tissue.
When it's used well for the right patients in the right location, it can be great.
And not
But
too frequent, probably.
exactly. And sculpture also doesn't require as often of an injection per se.
But I think that's the problem with this is when you're starting young in your 20s, like some of these 22 to 25-year-olds are starting these procedures.
Mhm.
And it's just like how we talked about breast implants. Like if the earlier you start, the longer road you're going to have and more scar tissue you're going to have building up of all this.
And that is an interesting point, and I feel like we will see that in sort of 10, 15 years of what those patients are feeling.
Yeah.
And we'll also see kind of like, okay, how is that changing kind of plastic surgery as a journey for
The
somebody who
trends.
starts early? So
Yeah.
I'm curious to see sort of how that changes things and how the public perceives that too.
What is the actual procedure of a facelift? I feel like there's a lot of different theories about how a facelift is done. Like, I'm curious where cutting happens, where scars are.
Definitely.
You can see some bad ones around Newport Beach when they're like in front of the ears. You're like, oh, you can't wear your
That's
hair
what
up
it
in
is,
yoga
yeah.
class anymore.
Yeah.
So facelift is making an incision essentially around the ear. It starts kind of in the hairline. and you
Okay.
curve around all the anatomy of the ears to hide the scar as much as
Mhm.
possible behind the tragus. That's what you were referring to, where if it's in front of the tragus, it's very obvious. And then we try to put it behind so it hides along sort of the curvature of our natural
interesting.
anatomy. And then come in front and then go around behind the ear to the hairline. So that if you cut that open now, it exposes us to sort of this area of the face, the cheeks, and the lower jaw, as well as even the neck. So
So you go
people,
through there for the neck as well.
correct. So people
Oh.
will ask, oh, I don't want to do the face. I just want to do a neck lift, or I just want to do neck lift. I don't want to do facelift. It's like
I'm
the
already in
same-
there.
It's the same incision. Might
Well,
as
let me help
well
you out.
take
Yeah.
advantage of both.
Of being open on the
Um,
table.
Exactly. So anybody who gets a neck lift alone is essentially getting the old traditional skin only, no smash work facelift because this part has already been sort of cut here and
Yeah.
you can tighten that skin. So that's something people wonder, can I just get one over the other? And it's usually kind of a combo procedure.
Well, and I feel like the internet is such a slippery slope for any of these procedures because you see things of before and afters, or you see somebody's journey. And, the internet, I feel like, is always lying to us. But you see these ponytail facelifts that they go in, minimally invasive, and then they look like they were 65 and now they look like they're 40. But those can be not only hundreds of thousands of dollars, but they can only last you, I've heard, like a year or two before you're back looking like you were before.
A
And
year? That's crazy.
I've heard some of them that like, and again, this is like, I've heard. You're like, no, I'm going to correct you. That the ones that are super superficial, like aren't going super deep, that you're up there, but then like after a year or two, you're back where you were.
and that's how our facelift surgeries evolved through history too, is it used to be just skin only, where we just sort of pull the skin back. We dissect the skin and then we pull it back decades ago.
Yeah.
And then afterwards we saw, oh, okay, if we also tighten the
Muscles,
muscle
yeah.
underneath, then it lasts longer because it fights against gravity better than skin alone. It's a little bit more bulky tissue. So the facelift we do in today's world is all sort of a version of doing the muscle work, and we call it sort of the smash facelift and deep plane facelifts. All of those were essentially, are we moving the skin and muscle together when we're pulling it?
Okay.
Or are we just pulling the muscle and then laying the skin on top?
And can it almost be a combination of those things where you are in the face?
Yes. So
Like you're like an
even the
artist.
deep
It's like you're an
plane
artist,
facelift,
right?
we're not going under the muscle till sort of like a certain line in the cheek. So
Mhm.
yes.
This is wild. Can you believe
And-
this is your job?
No, I know. It is
Isn't
so
crazy?
crazy. Well, so what if someone like when they ask for a facelift, like if they want contoured more, like can you do that with just the facelift, or do you need to like do fat? Can you put fat in? Do you do fat in face?
I would say most people
Are
when
now
they're
doing fat in face, right?
Definitely. That
Okay.
it's part of sort of
Volume. You
making
want
everybody
volume.
look good.
Well, yes.
Yeah.
I don't know. I don't know
want
where,
volume.
No,
Wait,
same,
also-
but I want like this no volume, like
No volume
skinny,
here, volume
no
here.
volume here.
Some
Yeah.
people like that Danielle Bernstein, you know who she is, the influencer in
Oh,
New York. We
okay.
wore what? She just did a fat transfer under her eyes. Which
Oh,
thought
I
was
feel like
really
a lot of people
interesting.
are doing that now.
Mhm.
That's
Mhm.
common too. Like you do the upper bluff, take it from here, add it down here.
Yeah.
But that helps look youthful as well.
Yes.
Okay, so question
The
then,
menu-
if
the menu of options.
if you're our age, you know, like in your, I would say most of our listeners are probably our age, like mid 30s, heading into our 40s. We want to look rejuvenated in the face. Would you say, and again, I know it's so specific, but like go explore the bluff brow lift situation, or like should we wait and consider facelifts like in our 40s?
Hmm. I think that's also kind of the camp of go to a plastic surgeon
And really
get-
break it down.
Yeah, and at least see like two people, because people are going to
Oh,
have
yeah.
different. It is
Or
plastic-
3, right? I mean,
absolutely. I do think plastic surgery, it is a very unique field in medicine where art is part of it. So
Mhm.
when we're all drawing an apple and somebody's using like a pastel to draw it, and somebody else is like using a pencil crayon, like those are all within reason of drawing an apple. So it's
they're
nice.
totally different results.
Exactly. But still an apple.
Yeah.
You know, I'm not going to be like, don't go to somebody who's drawing a banana.
Right.
But just getting a sense of how different people have different aesthetic eye and creating it in ways that are all acceptable, but one that works the best for the individual.
Okay.
And that's where, from the consultation and seeing befores and afters and kind of talking about the aesthetic eye of both the patient and the surgeon, does it align? That's also very important. So you don't go to somebody who has a very different vision for what is beautiful. And if it is different, having the communication to say, can we align?
Yeah.
So those are all very important, I think, before deciding, okay, am I a facelift candidate?
Right. Or do I
not.
do
Okay, how do you get matched with your plastic surgeon? Like what would you want your patients to come in and ask you? And like how do you, because okay, a perfect example, I need new
Mhm.
boobs. And I'm like, I don't even know where to start. I'm like, none of my friends have had boob jobs recently. Like I would go off of referral base, but how do you find that perfect match?
That's a great question. And I think referral does make a big difference because patients can actually tell their sort of own experience and journey. And that I think is hard to come across just from going on websites and Instagram, whatnot. So if you want sort of how was your overall experience like, I think referral friends and people you know will be able to tell that side of the story as what it felt like as a patient. In terms of kind of the aesthetic goals and sort of what you're hoping to look for, look at the before and after galleries of the plastic surgeons and see what catches your eye of like, oh, this looks nice. And then check out their social media. Then you get the vibe of each individual. So you don't have to pay certain amount of money for a consultation fee just to know like,
You're
is
not the right match.
person.
Right.
Yeah. Well, and some
Right.
of these consultations are like what, $1,500 in
They're-
some cases?
yeah, it ranges from a couple $100s to I guess $1,500. That's a new one that I heard. That's on the high end.
Yeah, that is on the high end,
It's
right?
like,
And
wow,
that's like,
I
oh,
need to reconsider my pricing.
yeah. She's like, by the way, ladies, this was your consultation.
Yeah, no, exactly. Okay, so I would imagine that you and majority of plastic surgeons are doing maybe more than one procedure at a time
Mhm.
on a patient. But I think we've seen on certain celebrities that there can be such thing as too many procedures in like
Mm.
one sitting. What is the like cap rate at okay, we can only do this safely and for recovery in like
Mhm.
one sitting?
Yeah, no, that's great. I would say generally you don't really want to go beyond sort of 9 to 10 hours in one
My
surgery.
God, I thought you were gonna say 9 to 10 procedures. I was like,
No.
wow, that is a lot going on. Okay, 9
Yeah.
to 10 hours.
But a deep facelift could
Yeah,
be
how long
6
does
to
that
7
take?
hours, can it?
Yeah, that I mean depends on the surgeon, but that's a all day surgery usually
Yeah.
A
because
facelift.
mostly because if you're getting a good quality before and after facelift, you are getting little kind of nano fat grafting or even just extra things, CO2 laser at the same time. You might be getting
Ooh.
some blepharoplasty work done. So there's also additional things that are done at the time of face
It's
and
not
neck
just
lift.
facelift. There's all these things that go in that to make a perfect
And that's
facelift.
why befores and afters today look a lot better than what used to be face and neck lift befores and
Yeah.
afters from maybe like
There's so
20
many
years
more things that
ago.
you can offer.
Exactly.
Wait, also, Dr. Min, within this, how do you prepare for a surgery day like that? Like, what are you doing the night before? What are you doing the morning of? Like,
Great
you're a
question.
mom.
Yeah. When I'm at home, I'm a mom. So if it's
Could you imagine having
No.
your kids
I'd
at
be like,
home and then
everybody
having
in
the
their
chaos?
rooms.
Oh my God, be
Mom's
like, I
doing
have got to
facelift tomorrow.
meditate. Yeah,
Yeah,
like, how do you
100%.
prepare for that?
there are cases, it depends on the case, I would say. There are certain cases that are very much like, okay, this is the routine. I don't do cookie cutter surgery, so every person is going to be a little bit individualized. But these are cases where you meet them in the morning of, and you're like, oh yeah, this one, this is what I'm going to pay attention, and you can sort of just think about the whole plan the morning of as you're
Do
marking.
you work out in the morning? Do you eat like certain kind of
This is where I'm
breakfast? Like,
struggling here.
what do
This
you do?
is
Like, I could not
I'm
imagine you
failing,
upset.
failing in that department. I hope to get into that when my
Goals.
kids are exactly.
Well, the
Um,
age 3 and 6
She's
is
lifting
hard
up
right
other
now.
people's muscles. That's her
Yeah,
workout
that is
right
your
now.
workout.
Yeah.
Amen.
so that part of my life is not working out very well, but I need to because in our 40s, osteoporosis risk starts to become real, and weight training and being mindful of muscle and bone health is very important. So aside from that, it's like mom life, work life, and
Yeah.
then sort of just going crazy in between.
Yeah.
Managing getting from there to them.
What does success for you look like after like seeing a patient after they've recovered?
Success to me is after the surgery, the patients get to see themselves for the first time. They've been unraveled and they're like just that feeling, the emotions that are in
Yeah.
the room of like, oh my gosh, it's a very palpable feeling,
Yeah.
and it is. I'm so grateful to be able to be part of that journey.
Yeah.
And it's such an emotional experience, just kind of like we alluded to earlier on. Like plastic surgery, is it also like a therapy session in the beginning when you first meet them? It kind of is, and there is a little bit of by physical sort of restoration of balance. There's also a little bit of kind of mental therapy there too,
Mhm.
of
Oh,
gaining
yeah.
that kind of confidence back into the body, and it's such a touching time,
Yeah.
and I'm just very grateful to be able to witness that in
Yeah.
person.
Well, it's like you look good, you feel good, you show up good, and like
Yeah.
being able to transform somebody within their most vulnerable times, it's got to be really
Mhm.
cool.
That's
It's
Absolutely.
so
rewarding.
special.
Yeah.
Yes.
Well, thank you for answering all of our questions. Like I feel like we need to go in
I know,
and get like a
right?
real
I
consultation.
seriously.
So good. Okay, before we let you go though, we're gonna do like a quick 10-minute thing for our Patreon.
Mhm.
So this is
But
much
before
more.
we get to Patreon, let's tell everyone where they can
Yes,
find you.
please, where they can
Yes.
find you.
So my practice is in Beverly Hills, and it's 416 North Bedford Drive
What a
within
good
the
address, too.
within the Beverly Hills Triangle. And you can call the office, and then my patient care coordinator will also usually connect with the patients before coming in. I think it's better to not be surprised on the day of consultation.
Oh, yeah,
So
100%.
she'll explain kind of what I usually do for different kinds of surgeries, and then also introduce me, what my backgrounds are, what my expertise are, and then she'll give more informations on here is consultation fee, what here is parking, this is what it looks like, and by the time the patients come in, then they'll know. Like,
It's just all the fun stuff
yeah,
now.
like, I
Let's
feel
get
like
to
I've already
business.
Yeah.
exactly. And
Yeah.
then by the time I'm mentioning kind of my surgical plans, any part that overlaps with what was already told to the patients, they're like, yes, heard that.
Yep.
And second time, it just registers better. So you don't feel like you're putting your head by a fire hydrant during the
Yeah.
consultation.
Totally.
Well, and it's a
Wow.
lot of information.
It is. It is. So I always encourage patients to bring somebody else. So there's a second pair of ears who will have absorbed some other parts of the information.
Yeah.
So those are other tips.
Yeah.
Yeah, because it can be overwhelming too. Okay, so for Patreon, we like to talk much more candidly. So, okay, 2 things you mentioned that I was going to ask, but then I thought I would wait.